Hi everyone, welcome to another episode of Uniquely Me with Simone Stewart. This afternoon, we want to talk about the whole matter of endometriosis. I struggle to pronounce it, but bear with me. In March, we would have had World Endometriosis Day, but I think this is something that, boy, the impact it has been having, it needs more than a day to address it. And so this afternoon, I have three fabulous ladies to discuss the whole matter, helping us to understand what exactly is endometriosis. So as usual, you know, on a Saturday evening, we come live. We ask you to get your popcorn. We ask you to get your juice, whatever it is, get those and come back. We are going to dig in and we're going to hear the struggles, the traumas, and how these ladies are living with this disease. Maybe you are listening, or maybe there's someone you know who is suffering with it, and so you want them to get firsthand how to handle it. Well, go dial them up and come back. Stay tuned. We'll be right back.
Calling our women from Spanish Town, Kingston, Montego Bay, St. Catherine, wherever you are, it is the Uniquely Me with Simone Stewart presenting Girl Get Up, Take Up Your Bed and Walk. It's a women's conference featuring Camille Cook, Donette Acosta, Simone Howard, Sheena Lynn Hanson, Rene, and Minister Clayton Roberts, hosted by Latoya Lang Smith. When will this be, guys, you ask? It's going to be Saturday, April 16, 2022, beginning at 9 a.m. Where? Open Bible Complex at Twickenham Park, Spanish Town. We are calling all our pastors' wives, women in leadership, women who have been through trauma and recovery. It doesn't matter, as long as you are called woman, you need to be there. Cost is only $1,500 and a pack of sanitary napkins. Guys, you ask why sanitary napkins? Well, we are launching the 2022 series of our period poverty campaign. You need to be a part of this. Our goal is to raise 2,500 packs of sanitary napkins for our girls and women in Jamaica who cannot afford these items. So guys, come on out. It's Saturday, April 16, 2022, starting at 9. It's entitled Girl Get Up, Take Up Your Bed and Walk. Refreshments will be on sale. We say Uniquely Me is uniquely you, and it's time, girl, you get up. See you there.
Uniquely me is uniquely you. Balancing the different hats of life, achieving all your goals in the name of rest. Uniquely me is uniquely you. You can do anything. With the S on your chest, you can do all things through Christ who gives you strength. You are a winner and you're an overcomer. You can be all things to Christ who gives you strength, yeah. You are a fighter, you're so determined. Uniquely me is uniquely you.
Hi everyone, welcome back to Uniquely Me with Simone Stewart. As mentioned earlier, we are looking this afternoon at the whole matter of endometriosis, the struggles, the traumas. How are our women living with this disease? And of course, I'm no authority on this, but I have three fabulous women who are going to be sharing their story, their struggles. I have Rene Wint with me. I have Kadine Stewart, and I have Nordia Barrett. And so these ladies are from three different spectrums of the whole matter of dealing with this disease. And so they're going to share, but I'm going to allow them to introduce themselves. Let's start with Kadine Stewart, my namesake. Kadine, share a little bit. Who are you?
I am Kadine Stewart, and I'm Kadine Stewart. I am from Kingston.
Mm-hmm.
My favorite scripture is, I can do all things through Christ who give me strength, and greater is He, which is God, who is in me, than anything of this world.
Yeah.
I am a certified early childhood caregiver.
Mm-hmm.
I operate a mini daycare at home, and I love children and nature. I Yeah, that's me. I am an Endo warrior, and
Yeah.
I know as Endo warrior destined for great.
Okay. I didn't hear that last part. You're an endo warrior and what?
Destined for greatness.
Destined for greatness. How long have you been living with the disease?
Since I've been going back and forth since 2007. I was diagnosed in 2018.
Okay. All right. Thanks for that. All right. Over to you, Rene.
Hi everyone, I'm Rene Wint. I'm from Clarendon, former Glenmuir High School student. I'm currently 21 years old, and I have been battling endometriosis since 2016, so that's over 6 years.
Wow. Okay. Well, we'll dig in some more to hear what has life been with it. And Nordia Barrett, share with us, who are you?
Hi, Simone. Of course, I'm Nordia. I am an endo warrior, like the other females. I am probably the longest fighter or warrior in this phase of things. My last, 16 to 18 months, I've had 4 surgeries. And over the duration of my lifetime, I've had 8. I have been suffering since high school, and to put that into perspective, I'm 38, 39 in May. So it has been about 23 years of suffering.
Yeah.
I must say though, since my last surgery, December 2021, I have been doing pretty great. I try though not to just fight endo, but fight generally. So as we progress, you will know that I have been doing different things during all of this that has been happening. So, because I know that life doesn't pause for me.
Yeah.
Time doesn't pause for me, so I have to keep going. So that's basically me in a nutshell.
Awesome. Awesome. Well, ladies, I first want to congratulate each of you, because my research and a few friends that I've had who has been suffering with the disease, it's not an easy one. And so I don't know which of you would want to take it first to share what your journey has been, exactly what in having endometriosis or having been diagnosed, what were some of the stuff that was happening before you discovered exactly what was happening to you?
If I may go first, pain. Pain in common letters, pain in capital letters, just pain, a lot of pain.
Yeah.
Bleeding issues as well, but more so the pain.
Yeah.
I am what they would say, I am symptomatic. So wherever the lesion goes, I get pain from that. So I am one of those persons, if I were to share with a family member, they would say to me, 4 surgeries, doctor, I don't know what them are doing. This is pretty much because they don't understand the disease, 1, and 2, they don't understand that it's invasive. It can go as far as your brain.
Wow.
The lung, the spleen, it goes anywhere, just about anywhere, right? I would want to say endo mimics cancer, except that it's not deadly. We will suffer the pain, but it's unlikely that we're going to die from it once we get treatment.
Yeah, yeah.
So I think the biggest error that sometimes take place with us is the fact that our pain is taken for granted.
Yeah.
Inside the home, at the medical offices. So you may go and they say, listen, just take 2 painkillers and go lie down. But I don't know why you behave so over this thing. So as time progressed, even though the pain progressed, it got worse for me, my body was responding differently. So I was no longer vomiting a lot like I used to in my younger days. I don't have the fainting spells again like in my younger days. So what I find is that my body got a little more resilient with what was happening, even though I was in a lot of pain. And sometimes I'd walk around with it, and you probably, if you don't know me, you not know that I'm hurting. But if you know my face and you look in my face, you can see that something like really, really has been happening.
Yeah.
So because of how it is treated and dealt with, I think that is the reason I've suffered for all of 20 odd years without appropriate help much sooner.
Yeah.
I must say though, my medical team, big up to them, because of course I'm in Montego Bay, but I am supported both here in Montego Bay and my chief surgeon is in Kingston. But once I enter the emergency room, I am taken seriously. I don't know if it's because I'm more of an adult now and no longer in the teenage or the early 20s age group. So they give me a little bit more attention. I really don't know what that is, but I find that I get far more help now.
Yeah.
What would I say that I used to cope and tell people how to cope is stay mentally resilient. You're already hurting physically, bodily. Your body's under a lot of pressure, a lot of pain. Usually when the pain stops for me, I am exhausted. I don't know if the other girls experience the same thing, but I'm super exhausted once the pain goes, and I automatically want to sleep. I can just stop the vehicle just about anywhere, and if I rock back the seat, I'll fall asleep. That's the kind of fatigue and exhaustion that comes about.
All right, hold on, Nordia. Hold on. I don't want to share yet how you deal with, how you cope yet. I want to ask the other ladies. Let's go with Kadine, because I see her shaking her head, if she can identify with some of those things that you just shared. Kadine, sorry.
So for me, when I started in 2000, by the way, I'm 36. So when I started in 2007, it was always when the menstrual started in teenager years, but then it got worse, and then pain. And then you start to follow it up. Like I have a foster mom who started to follow me up with this terrible pain, and doctors keep giving you a different birth control to say it's hormonal issue or it's just pain. So they keep on giving me hormonal pills to see what could do. And so bear in mind, I have
so you're misdiagnosed by your, well, I don't know if it's to say misdiagnosed, but there's a case of misdiagnosis happening with our doctors.
Well, based on where I am coming from, I think doctors they're not properly identify what's happening in your body, and so many cases I've been to doctor, they keep telling me that it's hormonal issue or whatever. So I've been given contraceptive over the years from as early as 2007, and I remember I think in 2008, 2009, I went to the doctor emergency room, and I was given like 8 injections and a lot of fluid trying to see the pain. And I was bleeding very hard and heavy clot. And they did a CT scan, and they told me that one of my ovaries is enlarged, but there's nothing to worry about. But then they give me more birth control pills. They keep changing it, and they give me I keep doing tests, blood tests, all kind of different tests, try to figure out what's happening. As I go, nobody can tell me what happened. They just keep giving you different medication, and then by now I'm getting tired of medication and painkillers. Painkillers doesn't help any at all. I remember one time I started seeing different gynae. I moved away from the public hospital. I go into different gynecologists, and they didn't know what was happening. I remember one time they speculated to say it could be endometriosis. That was the very first time I am hearing such name, endometriosis. I was like, what is this? So I came home and I went to church, and I went into the library and I looked for a book and went into the encyclopedia to see that word name of friend. I would see endometriosis, and then like, okay then. So based on when I look upon it and based on the symptoms, I started to diagnose myself to say, okay, this could be endometriosis and all the things there. I go for years and I go for years without any result. And the pain is so horrible. It's like a thorn in your flesh. It's like when they put the crown of thorns on Jesus' head and it got on them. That's how horrible it is. But then each time it hits you, like you're constantly fighting against your body. Like it hit you this month and you figure a way how to fight it. Next month, it's planning for you. You better believe that it's a plan for your body because you're planning for it and it's planning for you. So it's like you're constantly in tug and war with your entire body. Sometimes you don't even know how to move one foot to the next foot because the pain is so rapidly. The pain is so, it's just terrible when you know. Pain is for me, is when you know that I can shape my body in all the letters of the alphabet because that's how pain is. Vomiting, diarrhea, nausea. I get everything. I have to sleep with heating plug into my belly. I remember in 2015, I heard about this Daniel fasting and somebody told me that it's something you went on and get your healing. And bear in mind, by the time I have a whole long sheet of lists, the doctor gave me to go and do blood tests and all kind of different tests. And I went on to that fast in 2015. And at the end of the fast, I think I got a breakthrough and some stuff come out, like some really stuff come out of my body. Like, what is this? But then I went for 3 years and by then I removed myself from all medication. And then I see at the end of the fast also, I was introduced to the endometriosis website. That was the first one on Facebook. And then I started to follow it up and I saw one of the girls showed me the endometriosis diet. I was like, okay, so the very same thing I did on the 21 day, I think God prepared me for endometriosis diet in 2015. I started doing the diet, I removed meat and stuff and everything. So I got a 3-year breakthrough. In 2008, I was at summer camp in July and I felt something. I was like, my foot went like it got paralyzed. My menstrual started. My foot got paralyzed. I can't move. I started to scream. I started to cry. What's happening to me? And the nurse doctor took me to the room and put heating pad on me and everything. I went through the week at camp because I was at camp auntie, so I couldn't give up. I have to press through. I came home and I was there in the room and I was bawling like, Lord, I need help. And the thing about this, where I was working, I work in a church organization for 13 years. So they understand because I miss work like a whole heap. I miss work. There are days when I'll be at work, I'm in pain. Even, without menstrual, you're having pain because there's pain before the menstrual, there's pain in the menstrual, and there's pain after menstrual. And so I'll be at work sometime and a pastor will came by like, Kadine, you have to go home. And they carry me home. So my boss always said I'm dead, call me the dead and wait because I will live down for 3 days. And then on the 4th day, I'm right and I'm up. You'd never know that I'm in pain.
Right. So hold on, Kadine, hold on. I want to bring Rene in this. Rene, help us to define what is endometriosis for starters, and then share what or at least from your perspective, what is it and your experience?
So medically, endometriosis deals with the lining of the uterus that grows. It grows outside the uterus. Other places can be deposited anywhere in the body. So our keyword that defines endometriosis is pain, as Nordia was saying. That encompasses endometriosis, especially for those who are symptomatic. For me, I haven't been experiencing the effects of endometriosis as long as the other ladies, because quite frankly, I am way younger. So the first thing I think young ladies, when they start their periods, they think of pain, that periods consist of pain. But I learned that that's not true. I started my menses probably late, at around 14, in 2016, when I was 15 years old, after I completed a cycle. The day after I woke up, I couldn't move, couldn't stand. There was this extreme pressure in I think it was my right side, my right pelvic area. And it was swollen. When I went to the doctor, I did an ultrasound, they didn't see anything. I ended up doing an MRI and they found a hemorrhagic cyst.
Oh, okay.
The pain was excruciating. I missed school. I was in fourth form at the time and I was missing a lot of classes. At that time, I was introduced to the word endometriosis. And they were talking about surgeries, but they said, you know what, she's not ready for surgery because we just found a hemorrhagic cyst. And when you have teenage girls with something like this, it's probably endometriosis. I didn't do a surgery. I was put on Depo-Provera. It didn't work for me.
And that's a tablet or an injection? What's that?
Oh, that's an injection. That's a hormonal injection.
Okay.
Then I was placed on birth control. Surprisingly, it did work. And, there's a stigma around birth control, especially for teenagers. So I wouldn't share with anyone at my school that I was taking birth control because that wouldn't be the first thing that would come to their mind that, oh, she has endometriosis. That's why she's taking it. So, and after when I started getting comfortable and I'm like, this disease it's horrible.
Yeah.
Let me tell my other friends who are experiencing the pain and I'm seeing that you're experiencing lots of pain. I said, you know what? I think you should take birth control. Tell you. But they're like, oh, the stigma comes back again. They're like, why should we take birth control? But I'm like, if you like the pain, do that. If you can start taking birth control as you start feeling the pain, great for you. So I started the birth control. It worked for a little while. Thank God it worked in fifth form for me to do my C-sec.
Yeah.
After things started to go downhill for me, I realized that I was feeling a bit more pain when I had my menses. I was like, Mommy, something's not right. But I didn't pay much attention to it.
Yeah.
Because I didn't know endometriosis could get that bad, even though I had it.
Right.
And I was in pain. I was feeling pain in my menses. And then it was just this one time I was at badminton practice. I left, I came home, I had an IA that I was trying to finish up and throughout the night. And I'm there and I'm like, I am in pain. I'm in pain. I'm in a lot of pain. And I normally think I have a high threshold for pain because even my friends, I have a friend that I would share things with. And she's like, I know you're very private, but I know when you're in pain, when you try to hide the pain. I really do try to hide pain. But this time I couldn't hide the pain. The pain was overwhelming. I was crying. I went to my mom. I was like, Mommy, something's wrong with me. I was crying during that. Like, they don't know the painkillers wasn't working. Then found out like a cyst, just a small cyst ruptured. I guess that's what was causing the pain during the night. And throughout the rest of my period at school, it was horrible. My uniform, it couldn't touch my skin. I was at school and if someone grazes my hand or something, I felt like I was dying. My uniform touching my skin when I came home and could take it off, that was heaven. Wow. I was in pain at school. My belt around my uniform, still. It was horrible because it was around that region, my belly region, and any part, my skin was just on fire. I didn't know that endometriosis was causing that. I was getting tired more easily, and school was getting hard for me. It was getting hard for me to continue. And I was an honor student, and I was like, I feel like it was harder for me to keep up. The energy that I had wasn't there. I didn't have any enthusiasm.
Yeah.
I was just always in pain. And I'm like, I can't focus on anything right now. I'm just focusing on pain. And that was me going downhill as it related to endometriosis, because I started to pass out shortly after that.
Wow.
I was even overseas and passed out a couple of times, found out that it was just dysautonomia. So it's like the pain is causing her to pass out, but I'm always in pain now. Normally I just feel the pain around menses, but I'm always in pain now, and I'm always passing out. I'm getting weaker. And I didn't finish sixth form because of it.
Whoa.
Because I was passing out too often. And a lot of times that time I had to keep on going to the doctor for IV because I was so weak. I mean, I was weak till I couldn't talk. I couldn't talk. I remember the first time that happened to me when I passed out. And I think my parents thought I was dying because I couldn't talk. I couldn't move anything. You know, the only thing you know that I'm breathing.
Yeah.
I couldn't move my hands. I couldn't do anything. So that happened a lot, and I was always on IV till I did the surgery in December of 2018. And I did start to feel a little better as related to endometriosis.
Yeah.
And I was placed back on birth control. And, you know, it didn't work for long. I had to be placed on, I started to take, what's the good name? I think gonopeptile. You have that, there are some medications that they mostly give to like cancer patients when they are doing.
Lectrum.
You have Lectrum, you have another one name, I think gonopeptile. Yeah, they
it's
have
the same time.
Yeah, it is the same, different brands,
Yeah.
I guess. So there, so I was placed on that work, then it stopped. But you're not supposed to be placed on it for that long. I was placed on Lectrum last year, but I didn't like the side effects. I think the side effects were horrible.
Exhaustion. Hot flushes.
Some of them are menopausal symptoms. But, you know, it has been rough. I have cried a lot. I just like to think, you know, it was me, it was God right throughout, because it wasn't me. Yeah. It wasn't me, it was horrible. And I think I must be grateful for my family.
Yeah.
I have the best support system. My family is the best.
Yeah.
Painkillers didn't work for me. All those high painkillers, cataphractic, Fibromyalgia, those didn't help. I was like wondering, you know, people talking about those painkillers, like what? It doesn't help. I didn't bulge. It's just since recently I started to take, I would mix them and they started to work after the surgery.
So let me ask a question, because again, and Nordia, I guess you may want to take this. And since yourself and Rene have done surgery, why is a surgery necessary? Is it that it's so I know, like fibroids, you're taking out these clumps or these lumps and stuff. What is it that they're removing when you guys do surgery?
All right, so the first thing we need to establish, until you have done laparoscopic surgery, and they have seen with their two eyes that you have endometrial tissue in different places, you are suspected to have. Until that has happened, you don't know that you have endo. Everything else is a suspect. What do they take out? Any of the lesions that they can find. Wherever those lesions go, they'll search for them, because lesions are so tricky that there's no MRI or CT scan that is going to readily pick those up. And hence the reason it has to be seen with the naked eyes.
Wow. And you
fibroids,
breakdown.
For fibroids and ultrasound. An ultrasound will show you those masses in the uterus. But for endometriosis, those won't be picked up as easily. So that's why the first surgery is not necessarily to remove it. You have the opportunity to just check if that's the case. People tend to not want, if you don't have to go in, they don't want to go in. Likewise, the doctors, the first thing is not to go in. It's to try to help you to control the pain, control the different symptoms that you're having, and possibly do some kind of suppression. So if they're able to have that done, then you can go a longer duration of time before you have to actually consider to do surgery. But I want to point out something that I consider to be very, very important. I have learned late, but I have learned that there are gynaes and there are gynaes. So Right. So you have gynae subspecialty. So what you want is more of a reproductive endocrinologist. That's someone that is going to look at your endocrine system and what endo. They do other gynae stuff, but they definitely specialize in this and specialize in the laparoscopic surgery. And you want to work with somebody with experience, tremendous experience. Because the first, and when you find someone like that, they don't want to have you come in a million times. Oh, try this, come back, come back, come back, come back. They want to resolve the matter because so many of us out there are suffering. So they're sometimes bombarded. So as soon as they can resolve your issue, they will try to ensure that that has been carried out. Endo is pretty expensive to deal with. Because the clinical menopause, for instance, when Rene spoke about like the Lupron, you're talking that's 100,000 for 3 months of Lupron. You may be able to get the cheaper version, the Electrum or Luperin, one of those other ones, but regardless of where you put it, it's still expensive. It's still costly. It's costly to afford. So what you'll find is that you may be placed on things like Depo-Provera. So if you are lucky enough that when you get Depo, it stops the period, then perfectly fine. Because once the period stops, things unpause for a moment. I have not been one of those.
I'm happy you went there. So is it the case where it is tied to your period? You're guaranteed once there's a period, there's going to be pain. If we can or control it, then the pain is gone.
Important question, very important question that you have asked. And I will also answer another one that you haven't asked. All right. So yes, it has a cycle. So those endometrial tissue, wherever they go and grow, they have a cycle of their own. I don't know if it's fortunate or unfortunate, but we seem to have regular cycles. Every single month you can expect your cycle on the clock, right? And of course, the pain comes with it. So what you find now, the next part I'm answering, what you find now is if, let's say we were to do hysterectomy, because hysterectomy doesn't resolve this, then the cycle continues because those lesions, wherever they are, they continue to have regular cycles, and those cycles come with pain, and they bleed wherever they are, and those lesions bleed and they grow. So it is pretty complicated. It's a pretty complicated situation. And as much as I am not a doctor, I sometimes feel sorry for the doctors that had to work with me because.
All right, Nordia, it seems as if your connection is going. I'm going to come back to you. I want to know from your connection just went. I want to know from Kadine. Is it my connection that is Kadine? Right. You hearing me? Are you hearing me?
Hi.
Right. I think the internet seems to be, your connection is unstable.
I'm hearing you.
Right. I want to know for you, what are some of the implications? What is it that you have found? Well, I'm asking the other two ladies too, the implications, having had this, what are some of the things that you've had to deal with that are cases that have worked out to becoming very unpleasant?
So for me, as I said, painkiller doesn't help me. Medication on a whole doesn't help me. I think it's only the band-aid that make it get worse. Recently I was given the Vicine, which is at 10,000 for the month, per month for that medication, and I had to stop taking it. And so what I have come to realize is that diet can help. regular exercise can help. So for me, I don't eat half of this world, like most eat vegetables and stuff. And even so, you have to be careful what type and how much you eat and what to eat and what you don't eat. So if they can remove eating healthy stuff, but then there are stuff that might cause pain too. Because recently, last month, I went to see this holistic lady, Natalie Murray, at the live store on Constant Spring.
Mm-hmm.
And we got through the process of thing, because even though I wasn't eating red meat and I wasn't doing the flour and those stuff, because flour and those stuff, gluten, they cause pain and stuff. So she had now told me that fruits and sugar in fruits cause pain. And I removed them for this 1 month. And this month is like the best period I have, because I'm now doing like vegetables. I did more vegetables, I do more workout, I drink more water. I used to snack on foolishness, which I now have to cut the snacking from foolishness. So I realized diet change help. But then in life, if you eat even if you don't eat some stuff, it's going to cause pain. Because I have also discovered that even the sanitary napkins can cause pain, because it's your bleach product, and that cause pain. Even the detergent that they use can cause flare up. And for me, when I have flare up, I think I'm 18 months pregnant. Not 9 months, no, 18 months, because I have a huge gut in front of me. I don't want to keep on clothes. I can't wear anything. I get ugly. And endo has caused you to become so isolation from the world, that because people see you and they will say mean stuff to you. Like, I remember one time I was so bloated, and I was going to church, and somebody said to me, "Why are you looking like that? You're looking like a stuffed jack mackerel." And that hurt me so bad that for me now, it's easy for me to stay inside than to go outside. COVID was even awesome for me, because I don't have to leave my house. So, yeah, people are mean and they can say stuff, and they don't know that you're going through stuff, and they see you looking so bloated, and they don't want to talk about your symptom, because I don't think person understand it. But I get to socialize, and I have a friend. Her name is Latoya, and I think she know endo even more than the doctor now, because she went and she do a research, and she get to know endo, and she get to know the symptoms. She get to know exactly. She can share. She might not can feel what I'm going through, but she can picture it. When I have in pain, I'm gonna call her and once she see me calling her, if it's 12 o'clock at night, I'm gonna call her, and she's gonna stay on the phone with me and listen to me cry. I just bawl. I'm on the ground and everything, and just bleeding. So she's my warrior friend, my warrior sister, my everything. She's there.
Yeah.
And Natalie Murray, the live store, she has given me some product this month, and trust me, like holistic, real herbs that helped me this month. I walk on water, mountain water, top the sea this month. I don't feel no pain. I'm not bloated. I think I feel confident this month. Trust me.
Awesome. Wow.
To have menstrual this month, I really, really, really feel like, yeah, this is Kadine. I can walk with my head up and not have to hide myself. I went to church while having menstrual. I went to church, and normally once my menstrual starts, I am pinned to the bed for 3 days with a water heating plug to my belly and vomiting everything. I don't eat. I can't eat. I can't do anything once I'm menstrual. I can't focus. I'm drained. Literally, it drains you.
Yeah. All right, hold on. Let me ask Rene, because I see there were some areas that you mentioned that I see Rene shaking her head on, especially when you talk about, what persons had to say or the effects on your body. What have been some of the effects you've seen, Rene? Separate from, I know you did share that you would pass out or stuff, but are there any other physical changes that you have noticed on your body?
Well, when I just started, other than the pain and passing out, I would throw up a lot. I was barely eating, other than weakness. Since recently, I realized that I started to have bloating. I didn't have bloating before, but I have started to have bloating now. And I remembered you asked a question about the menses, and if you don't experience the menses, if you won't have symptoms. Well, I just hate periods. I I I don't like seeing it. My doctor knows this. He knows that I don't like seeing it, and if I do see it, it is horrible. So he tries his best with me to limit the times that I do have my periods. So even when I'm not on it, sometimes there's a flare up and I would experience pain. Another thing was that I think it was Kadine who was talking about persons input. A lot of persons like at first are like, Endo, why is she going on like that? She can't be feeling pain every day because of something like that. A lot of persons didn't believe it at first, and that hurts when people don't believe it. That you're thinking that the pain is in your head, and that's horrible. If people think that the pain is in your head,
I think you're mad.
That upsets me when persons don't believe in my pain. Like, why would I pretend that I am in pain? And they don't believe it can be that bad or that extreme, or you're too young to have endometriosis. Okay, but I realize that a lot of persons around me have learned about the disease, and they're like, you know what, I'm sorry, I didn't know that. I didn't know it could cause that, and I'm sorry that it's happening to you. So I believe that a lot of persons have learned about it, especially those around me. But the disease is horrible. Yes, I do have vomiting. I do have a pass out. I have pain. I started experiencing bloating. You have headaches. Then there is depression,
anxiety.
Yes, and you can't do things that your peers are doing, or you can't go at that time or stuff. You're having a flare up right now. That sort of thing affects you.
Yeah.
That sort of thing affects you. But yeah, you have to be strong. I was strong in faith. That's what kept me so long. And you need a good support system. You do need a good support system.
Yes.
And as I said before, I am grateful for my family. I love my family. I love my parents. I have the best parents, and I thank God that they could afford to give me the proper treatment, everything that I needed, and I still need. My entire family, they have been great to me.
Yeah.
And I'm extremely, and I'm glad I could use this platform to just tell them thank you.
Wow.
They have been great. They have been great. I can thank God for them. And it's not that a lot of ladies do not have that. And it's sad. And I'm sorry that they don't have it, because you really do need it.
Yeah.
You really do need it. Support financially and emotionally.
Yeah.
And so it's hard for a lot of ladies out there. And I'm very sorry that they have to experience it like that.
Yeah. I want to. Sorry, go ahead. Finish what you were saying.
No, I was saying I was experiencing pain every day. Regardless of my menses, I was feeling pain every day.
Wow. Nordia, sorry.
As Rene shared about the financial aspect part of it, for me, I think that was a struggle for me. So I think I suffer as a child growing up. Your background, you never have the funds to follow up what's happening. And so financially, I think if you're not financially stable, you're going to suffer. And I think I suffer because of such background.
My God. Wow. Wow.
Because even the surgery is very expensive. Surgery is very expensive. So a lot of ladies would have to set it back. And to even diagnose it or to remove the lesions, to control it in some aspects. So
wow. Well, Nordia, I'm going to jump in with you, because you, again, I guess you're more experienced with this. You've done 8 surgeries. I don't know if you can identify with some of exactly what the other 2 ladies have shared, the expense, the stigma. But more so, I want to also ask you, after you've answered those, the matter of how does it affect, the matter of childbearing? Does it affect the relationship? For instance, if a woman is in a relationship, a sexual relationship, does this impact them and that kind of thing? So over to you.
All right. So in terms of, it doesn't affect relationship. It affects relationships. So in your home, in your workplace, you name it. It's a ripple impact. And so I always believe that sharing about endo is not to share with girls. Girls have fathers, girls have boyfriends and husbands, and this needs to be known. And the more it's known, the better you will be able to get the support. As it relates to my job, I believe I have tremendous support from where I work. They understood when I can't and couldn't. They understood because I would push against the grains each day. And yes, it's possible to have pain every day, like Rene. I remember September 2020 after I did that surgery, and and that was an emergency surgery, and we thought that everything was good. It was hell, pain, straight back until I had another surgery, February 2021. And we thought that everything was good, and then a lesion surfaced in my groin, and we had to do something about that August 2021. And then come December again, I had pain. I couldn't sit because lesion found its way in my, what they call your rectovaginal region. It was just
lesion. I need to find, you mean that their growth is that
yes, yeah, man. Yes, yeah. And don't believe that the size of the growth determines the amount of pain that you have. There's really no such thing, because my sister is also suffers from this. And I probably should put suffer in quotation because she's asymptomatic. So it's after they went in, they say, wait, you're ratting out, man. Because she didn't have the kind of pain that, she didn't have pain to say that something was going on. It was something else that caused her to do surgery, and they found that out. So there are ladies walking around with the challenge, and yes, it does affect childbearing. For me right now, I will have to do IVF. I'm at that point. So if I can't afford it, God help me. Where that is, or if we can't afford it, God help us. But as it relates to how it impacts on childbearing, it depends. It depends on the doctor. It depends on how soon you are seeing. It depends on how much they are able to do. It depends on how much they are able to restructure for you in order to put you back into that place of fertility. So there is some, and that's what the reproductive endocrinologist tries to do. They try to restore your fertility for you, to give you that that chance. If you talk about the cost of the treatment, I'm probably not the right person to talk to, because as recently as Friday, I walked into Dr. Harriet's office, and when I walked in, the receptionist said to me, boy, how you do? I say, I'm great. I'm well. And she said to me, you have been there. You have been through it. Yeah. And I said, but I don't live there anymore. And then I sat in front of Dr. Harriet, and because he was just doing a letter for me. It's not because I was sick. And he was saying to me, boy, I don't know how you do it. How did you pay for all of this and the finances? And I said, boy, Dr. Harriet, probably it's not such a great idea to ask me, because I too don't know. I approach the situation as it comes along. And bear in mind that I end up in emergency situations. So when I had to do surgery September 2020, it was just an emergency. Likewise, December 2021, it was an emergency. So it's a matter of finding the resources. I must say, to Sagicor has been amazing. Wow. Sagicor Health has simply been amazing. Aside from that, I had to find finances otherwise. And I'm not in one of those great paying jobs. And I utilize a facility like Hospital here in Montego Bay that understands when I walk in what it is that I am going through, what I'm experiencing. And their job is just to help me to restore to that place of no pain. I mean, think about walking around on morphine, or you have to be admitted to be kept on morphine for days just to ensure that you're restored to a place of normalcy. And remember that normalcy doesn't mean that you don't have any pain, but the constant day-to-day pain is terrible. And when it's really turned up, you have to really get help to turn that thing down. Like you have to get serious help to, you know. Vaginismus is something that can come out of all of this, because think about the rectovaginal region that is affected. So any form of penetration is pain, like tremendous, significant amount of pain. So that doesn't do well for a female like me that go through that kind of stuff. And it's literally like Endo just decide that, boy, I go walk over this. So, oh, you just done surgery. I'm going to walk over to that side. Oh, you never think about it. I'm going to walk down there so too. So it just keeps moving. And my inguinal area, that's my groin area, it has risen up in my groin area on 3 different occasions that they just slip and just take it out, because endo just surface there and it stays there for a duration of time, and it grows into a mass. The mass is not usually large, very large, but you cannot be fooled by the size of it. The size doesn't determine the amount of pain that you are experiencing. You see, support, need it. You need it. Because when people outside are saying all different kinds of things, your close support system is supposed to be combating that. And you can avoid the noise, and you have your support system to latch on to in terms of what they're saying, in terms of what they're telling you at that particular time. I safeguard myself though. So there are family members who probably won't know that I've gone through surgeries or going through surgery, because I don't need all that noise. Because if it's not useful, then it becomes noise for me. So I don't need all that noise. I need the mental capacity to cope with what is happening, especially on the day of surgery as well. You can't afford for your blood pressure to go up and then they say, oh, we have to cancel surgery for today. Remember, we cannot, it's not normal, it's not, you know? So you have to kind of ward out, just keep out as much as you can, the noise. I have friends who say that they're not able to laugh at me because I'm going to make a joke at myself first. And I will be the first one to laugh, and we will laugh together. So I don't give them the chance. I don't give others a chance to come in and do that. I'm my own entertainer when it comes to all of that, because you have to stay resilient. Physically you're suffering, financially you're suffering. We have to latch on, something have to go on to it. And I choose to make my mental be the part that is carrying for me.
Awesome. And so I want us to know, zoom into the coping mechanisms now. So I know, so mentally it's important to keep a positive mindset, because I did hear Rene would have mentioned about the whole matter of depression, right? We know the pain overall, the implications, you know, to how it affects our flesh, but the coping mechanisms now, I noticed Kadine had shared earlier on about diet and meditation, right, and exercise and stuff. But what else? Or maybe I should ask for you, Rene and Nordia, how important have you found dieting to have helped you? Because again, we've discovered that the medication is expensive and not everybody can afford it. But what other things can we, and this is now for the listening public, what else can be done maybe for that young lady that is in a situation where she can't afford it, or for that spouse that is listening, that brother, that sister that's listening, that friend, that whoever is listening, what are some things, some coping mechanisms that you have found to work and that we can encourage others to take advantage of? Rene, I don't
Okay,
want to go.
The first thing, one size shoe doesn't fit all. So because diet works for one, it doesn't mean it's going to work for the other. I do think you should try, you can try exercising. It will reduce the pain. Doesn't mean that it will stop it. Diet, I have cut dairy out of my diet and sugar for a while now. I still have pain, but it's not bad. But I can't say that it will directly help you, but I can say you can try. You can try anything that you hear about. I always have my heater. Some persons have the water bottle, the hot water bottle, but I use the plug-in heater. That's always by my bedside. And I guess it offers me some comfort. Sometimes it doesn't reduce the pain. It just gives me a sense of comfort.
Wow.
So a lot of things didn't really help me. Meds only helped me for a while. Some treatment methods only helped me for a while. Currently, I'm back on Depo-Provera, and I have been back on Depo-Provera from last year because we said, you know what, we're going to try it again. And it has been helping me. Last year, I had one of the best years of my life. Well, I shouldn't say of my life, but best year since 2018, I should say, because 2018 was, from 2018, I have been on a downward spiral. Another thing, I believe a lot of ladies with endometriosis start having other conditions such as fibromyalgia. I have it too.
Osteoporosis.
Yes, they start having other conditions, and it is horrible. I have a couple other conditions as well. I know Nordia has done 8 surgeries for endometriosis, but overall in my life I have done 4, and not all of them for endometriosis. But I have fibromyalgia right now, and it is fibromyalgia and endometriosis together, horrible. But I've been on treatment and I have been feeling better. And for those who don't know what fibromyalgia is, it's like a musculoskeletal pain. Yeah, I think that's the word. It's pain all over. You feel pain all over your body.
Yeah. Oh my God.
So you have a lot of pain all over your body. Sometimes you feel sick and you're not sick. So,
you know, I must ask though, do we think that some of those medications, because some of those medications that you guys are taking are very potent, could the medications have been what have stimulated some of those other situations?
Yes. All right. If I may, Lupron, for instance, you know that you get prone to osteoporosis. Any bone, because it's degenerative as it relates to the bones, right? So I've gone through the phase where I am not able to pull my clothes down in the morning. Like if I am up during the course of the night to use the restroom, my joints, tremendous amount of pain until I got off the Lupron, and then it just wears off. So what I recognize is that we need to have what you call add-back therapy. So if our bone mass is being affected, then we need to be taking stuff that is combating that in order to prevent that from happening. So whilst I'm not a doctor, I'm not surprised that Rene suffers from fibromyalgia because of the spin-off from some of the hormone drugs that we do take. As for me, the hormone stuff usually don't work, and I am back on Lupron. But what I noticed, Lupron is supposed to be what we call clinical menopause, right? Well, maybe menopause, but menstruation has not paused. so my body has fought against that. However, I can tell you, pain-free. I am doing like really good over the last 3 months, and I am journaling my way. Good. Because it is important to note these good days. Yes. I also started out by celebrating a week, then celebrating a month, and celebrating 2 months, 3 months, because I have to celebrate the small wins. I've been through so much, I have to celebrate the small wins. As it relates to diet though, cruciferous vegetables, you know, your broccoli, your cauliflower. Listen, endo is an expensive disease. So the stuff you're going to eat, they are also expensive. Black rice. Black rice is one of those things that works very well. And to avoid gluten, gluten-free diet is expensive. I have been finding inexpensive alternative because, like, let's say 2 pounds of oats, you'll find that for 2,500, but I've been to high-low and I've seen the container for 550, the same gluten-free. So I have been doing my shop around. The gluten-free, the black rice, you're talking about 3,100 for 2 pounds. If you're gonna go gluten-free flour, it's expensive also. So I've decided that I really don't need flour. Meat, I don't need meat, because in the readings, it tells you that some of these things contribute to. Are they proven? In some cases, for different people will tell you that different things happen for them. So it's a matter of trial and error to see what works for you. So there's no hard and fast rule that says if you do this, this is what will happen. But if you do your own little studies, you will understand how the hormone, soy, the hormones from soy, from milk, those things cause the issues for us as well. They don't do well for our reproductive system. Even for the person that isn't suffering from endometriosis, it doesn't do well for our reproductive system. But we do our own trial and error research, eat some of this week, eat some of that next week. What you'll find though is that we'll cut sugar. But it only means that we cut sugar with drink, but we're still having ripe bananas, which you know that fructose is also sugar. So you have to kind of pay keen attention to ensure that you're not having too much. So even though you're having fruits, you're not having 4 bananas. Because that would be replacing the sugar, the sucrose that you are trying to avoid. So in a nutshell, with dieting, it's a matter of trial and error, and break down your foods when you're trying. Don't have a whole mixture. If you do, it becomes difficult to figure out which one causes you to be having bloating and pain. So if you separate and break down over a duration of time and observe your body, pay attention to your body, note the differences, you will see and kind of understand what is happening and decide that some things you're just not going to be fooling around again.
Yeah. Say that again, Rene.
I'm saying this could be an anti-inflammatory diet because endometriosis, you have high inflammation.
Okay.
Yeah.
As Nordia was saying, as it relates to like the Lupron or the Lectrum, doctors, well, my doctor, when I was taking it a couple years back, I was placed on calcium because yes, exactly. So you have to have a good doctor who is accustomed to the disease. I have a great doctor and he has a great team as well with him. So I'm grateful for that as well.
Awesome. Yes, Kadine. Awesome.
So what I realized for me to track my bloatedness, I have a health record book where every time I eat something, I record it. So I remember in February, I had sweet and sour fish, and right after I have a big belly. So what I keep tracking and okay, now I went to the health coach. She told me that, okay, sweet and sour, I recognize that sweet and sour now have soy. Those things, you can't have them because when you have those things, you realize you have bloat. But once I stay in the context of not doing the sugary stuff, fruits and stuff, I don't have that big load. And as I said, for this month, it's been water top mountain experience for me of not having the fruits, the sugary stuff, and all everything there. Also, when I was diagnosed in 2018, I have a surgery to do because I went to a specialist, and he did the cervical examination, because I said I keep doing different ultrasound, which is not going to show it.
Mm-hmm.
So I have a surgery to do from 2018. I'm trying to raise funds for that to go inside to see how bad what's happening on the inside. And it's been a really rough journey since then. The emotional part where you sometimes you just find yourself a ball. Like you just set up a ball, you don't know what you're crying for, you're just crying.
Yeah.
And I don't know, but I think the good thing about having endo is that you know Jesus. Because if you never know Jesus, trust me. And then the word of God said that it's in your weakness that you become stronger. And he said, my grace is sufficient for you. Because when every time you get weak, it's like the grace of God, the strength that God give unto us, is like you get up stronger than you went down before. It's like you went on and beat the you know, but then God, he lifts you up so strong and mighty that you can just conquer the world and just know, say, all right, prepare yourself for the next part when come. Because trust me, endo is gonna come back at you. When you see you get stronger, him gets stronger, you get stronger. But then the greatest thing is that we all know Jesus.
Yeah.
And Jesus, that woman, I keep saying to myself that I am the woman with issue of blood.
Mm-hmm.
And I know that Jesus did see her, you know, Jesus see her and he knows that she was going through stuff. When I was diagnosed in 2018, I was putting back onto the mini-gynon. I was going to Heart Academy, doing a year in studying early childhood, and I bleed for 1 year straight.
Oh my God.
Like I bleed for 1 year straight. And it's when COVID hit, I was placed in a preschool to start working because I finished my course at school at Heart. And I went into a preschool for 5 months, then COVID hit. Then boom, I was home. So it was then when I have to reset my body. I removed myself back from the medication again and reset my body. And by that time, I was going to school, I eat everything I was not supposed to eat. I eat bun, I drink bug juice, I eat 3 chicks, I eat everything because school stress out and you don't have time to prepare food and stuff. So at that point, I have to reset my body and I'm like, okay, Lord, here we go again. And so God took me through that process. Before I was diagnosed, though, I was at camp and I think I got a specific word because I know I was in my room and I was crying like, Lord, I need help. This is sometimes I said to God, it's like, is me alone to put it on the cross? Like I asked him those questions, why do we have to suffer so much? Why?
Yes.
It's like I said, am I the one? Did I cut your sip or did I put the vinegar on the sponge and put it on your mouth? I was like the only one.
Yes, girl, I've said that.
I stopped pain and I said, Lord, I need help. And I remember I was listening to Travis Green song. This is my song that he said, you made a way. And I was in the room and I cried. And somebody from church, she called me and she said, the Lord said that she must call me. And at that time I was so broken. I just want to, if I get a cliff, I would jump off that point because I reach a point where I can't no more. And she said to me, this girl, like the Lord said to me to tell you that you have endometriosis. Remember that nobody could diagnose what's happening. I went to test and then I was supposed to do a biopsy. That's what it's called. We go to your neighbor.
Laparoscopy.
And then the doctor told me that even going through that process, it might not show it what's happening. And so when she told me that I have endometriosis, it was the second time, and I went to church and somebody has confirmed that I need to go and see Dr. Grutchy because he's a specialist in endometriosis. When I went to see him, they paid for me and everything, and I went to see him. That was the good thing about it because I didn't have the money. And they paid for it, and I went to see Dr. Grutchy, and he did the cervical examination, and trust me, it was horrible. I couldn't walk for days. I could not move for it because he insert what he needs to insert, and so it touched that thing, that sensitive stuff, and I like, bloop, I want to reach to the wall to know that something could go up inside of it, and it felt so hurt. And I bawled, and he told me that based on what he knows and what he'd been through 45 years of being an endometriosis, he now could tell me that I was stage 4 endometriosis and all them things there. And I walked from Half-Way Tree to Constant Spring Road crying. I bawled from Half-Way Tree to Constant Spring Road. And I cried. And I went, where did I went? I went to church. I sat in the back of the church. I went to prayer meeting. I cried. They prayed for me and everything. And so since 2018, it's been a really rough journey for me. He had given me the option of going back onto the medication or the depot, whatever those things. And I've been there, and now I'm in the process of raising the fund to see if I can go through the surgery to see exactly what's happening. The stuff, when I relate to the endometriosis, Riley, when I related to the endometriosis stuff, when I look at, sometimes I look at my ovary, my bottom belly, how it got swollen whenever when having pain or flare up. My belly bottom just have this big bulge pushing out. And so sometimes that causes for concern. And there are times when I got really scared, like I give up, but then God, he won't let you go. And keep on grabbing you and keep on comforting you. Not to
let me ask, is there any support system here in Jamaica for women that are going through this disease? Do we have any support system? So for instance, like Kadine needing now to raise funds for the surgery. Do you guys have a support system? Is there an association? What is there here in Jamaica?
Whilst there is the base foundation and you have the Endo Warriors group and you have little pockets of group around the place, the challenge is that basically everyone is suffering. So it's a bunch of sufferers, kind of. But on my part, I've had persons in the Endo Warrior group that needed to go see a doctor. They didn't have the money. They're running around. The public system handle them terribly. They don't have that access like I have when I take up my phone and I call or I send a WhatsApp, I get an answer. And I get an answer no. And they say, okay, go to the ER. I don't see where they're generally having that when I look into my group. So what I'll do sometimes is if I bounce back okay, I will transfer some funds to my gynae and say, listen, Rene is coming to see you. And he'll say, oh, that's kind of you. But of course, if I'm getting the support, and I'm able to sacrifice 50 cents, then I will. And I do it because I know that it's not easy. What I want to say though to most of the warriors or people who think they may have endo and don't know, pick your gynae wisely. Do your research. My first surgery was December 2008. And at that time, fibroids was removed and it was a myomectomy. That's the bikini cut. Fibroids was removed and my surgeon said to me after surgery, boy, you have endo. I notice it in your bowel region. If we trouble that, then you have to walk with a bag.
Jesus.
Because they can't pass stool on your own. But all he needed to do was to understand that as far as he can help me, it is basically over. Point me to the next person. So do some research or send me to do my research because I've now found someone who was able to. And I found them so late that my surgery lasted like about 5 hours.
Wow.
Right. That's 2018. Going back to a similar surgery, which was myomectomy and laparoscopy, both at the same time, inside, outside at the same time. Now, had he sent me to find someone, then I would have found someone. I would not have suffered that long. I don't believe I would have done 5 surgeries over the last 3 years or 4 over the last 18 months. Had that person guided me properly. So that gynae has led me to have an appreciation for my gynae here in Montego Bay. Trust me, love her to pieces. Love her to pieces, right? My gynae in Montego Bay, after surgery September 2020, we do a bag of tests up to December 2020. The same December 2020, I had a device inserted. The device wasn't doing anything along with the loop and along with all kind of things being what we were trying, and it wasn't working out. And she said, girl, listen, I am going to package everything that you have done, and I'm going to send you to one of the best there is. And that she did. And I asked her, please don't let me go, because even though I may be seeing this person in Kingston, I'm still here in the Western region. I still need your support. And thank goodness, she listened. Both have worked together for the sake of me getting well. I've had the balance of dealing with the two. And what's important about the balance is that I try not to bombard the best. There is, as she put it. I try not to bombard it, because you have people who really need to see him. But like for the small stuff, I return to her. She'll sort me out, and they will both communicate what is happening. So I am really, really appreciative of the team, and I'm appreciative of that doctor that says, listen, whilst I can do this, this person and his team will do a better job for you. When you reach a place that you just can't help us anymore, tell us.
Yeah.
If you can't research for us, tell us that we need to go and do our research so that we can have stuff done and sorted out. And we don't need to go through all this suffering because of your selfish desire to have us keep coming to you.
Yeah.
So that's something that needs to be looked at. And the general practitioner, he or she needs to understand that endo is beyond them. Once you get a patient, and because painful period is not normal, it's true, it's not normal, right? And once you get a patient, 1, 2, 3 times that person is coming, refer them. Stop, keep them coming and giving them whatever booster shot you can give them to keep off pain, and then come next month again, and keep off pain again, and come next month again. Because I've gone through a whole heap of that. I can tell you that I could own a $45 million apartment in Kingston based on the amount that I've spent on my health, just endo alone. Wow. Surgeries, hospitalization, medication, otherwise.
Yeah. Thanks for that. Thanks for that. Rene, I don't know, what do you want to say to the public? What can you say to the public in terms of them understanding and supporting persons living with endometriosis?
Well, I want to talk to young girls, especially because I wouldn't want them to experience what I have experienced.
Yeah.
I believe that once you start your periods and you have been experiencing a lot of pain, you need parents need to get their kids to a gynecologist. Gynecologist is not for when you become sexually active or when you're older, you're an adult. Yeah. Get your daughter to a gynecologist. It's not normal. It is not normal. I thought it was normal. The pain isn't normal, and it can reach to a point of no return. There can be significant side effects and ramifications because of it, and it can affect their lives. It can affect their lives and their future. As I said before, I had to take a gap year from school, and I didn't have that plan. And I wouldn't want any other female to experience it. And young ladies, don't let the stigma of birth control, if your doctor said, if you just start your period and they put you on birth control, just go ahead with it and stay on it. Because I realized that if you're on a certain medication, and like you stop, your endo tends to get worse after.
Wow. Wow.
I have seen that it gets worse after. So just stick to it, and everyone be supportive. Be supportive. The pain is real. It's not in our heads. It's not in others' heads. It's not in your head. It's not in your head. I am totally against that. It's not in your head. It is real.
Yeah.
It is real. Some persons don't start to some persons, you have endometriosis, you're walking around with endometriosis, you're asymptomatic. And you don't know that you have endometriosis until you start having fertility issues. A lot of women like that. A lot of women out there don't realize that. So, and it tends to run in your family, hereditary. So your mom probably have it, your cousins probably have it. It runs in my family.
Yeah.
Well, I have endo the worst. Others have PCOS and whatnot. But PCOS is, well, I guess it's not that you don't experience as much pain as endometriosis as I have had. So
Yeah. Thanks for that.
that's that.
If I might add, I noticed that Rene took a gap year. I noticed that Kadine was going to hard, she says. But for the duration of me suffering, I've gone to university 3 times. And in the middle of my master's, that's when I had surgery. That's September 3rd, 2018. And then, halfway through the semester, tried to recoup and then jump straight back into the school. I was advised, no, just skip the semester, but I decided no. Last year, just before, between August surgery and December surgery, I took on the project management course and program, and I did the exam. I was successful. But what I try to ensure that I keep doing is to ensure that I am living and I'm doing things. Because if you're doing nothing, then you get so caught up and focused on only what is happening to you right now. And that will definitely plunge you into depression. It's easy to plunge into depression. Easy, because everybody around you already have something to say.
Yeah.
And not necessarily your friends and family. Because I remember speaking to my doctor, the female doctor here in Montego Bay. I think it was in October, November, and I said to her, I'm starting to feel like when I go to a hospital or I do a doctor's visit, they probably don't think I'm sick. And she said, please, don't go there. Don't you ever think that. She says, every single time that you turn up, they ensure that I'm communicated with and you are being treated. But you can have a tailspin in your head thinking all kind of things, thinking what people are not even thinking as well. So if you can get the mind occupied, you can be helped. I also try to, depending on what is happening, I try to put more outcomes in the endo group than really processes, because I don't want my situation to get another girl down, because I don't know what others are going through. But I will put outcome, because the outcome is there to motivate them that, listen, we're suffering, but we're coming out of this one by one. One by one will be out, one by one, we can find a solution.
Awesome. As we wrap up, Kadine, because I heard Kadine had shared that she needs to do a surgery and she's trying to raise the funds. I think for this platform, I usually say when we get a platform to share, we never know who the Lord will touch to reach out and help. And so this platform, there has been Uniquely Me's aired all over the world. And I know women all over the world are being touched by this or are being affected by this. If someone wants to reach out to you, Kadine, how can they reach out to you? How can they support you in this particular drive of yours?
So I do have a GoFundMe page. I try to do GoFundMe But what my pastor told me, he doesn't work in Jamaica. So he has set up a platform where I have accounts on it where I could send let me get the email. Let me get it.
Do you want to share how much you're trying to raise or not? How much are you trying to raise?
1.2.
Okay.
That is probably you probably should go at 1.5 because one, from time to time, depending on what is happening to us and the extent of it, sometimes another team has to be added to the surgery. Like I've had that where a general surgeon and his team had to be added aside from the gynae and his team. So you don't want to go in prepared for one thing, and when that other thing shows up, there's nobody to help there. And also the medications and follow-up and preparation leading into, those can be expensive as well.
I saw Rene smile. Is it that, Rene, you're in agreement that, you know, she may want to add a little bit more to that because the cost can possibly go up?
Yes, I'm assuming that the 1.2 is just for the surgery alone.
Mm-hmm. Yes.
Yeah, so she would need some treatments before. Sometimes they give you like 3 months treatment. That can be expensive before surgery. You do a couple blood tests after hospital stay, depending on where she's going to be, and medications. Yes, so I think she should add a bit more.
Yeah, yeah.
And the medication, yes, medication that she's going to have to take after surgery. Those cost money.
So there you have it, Kadine. You're already getting some advice. So, yeah. So yes.
The website is tiafund.wordpress.com.
All right. I'm gonna ask you to send me that, and I will, when I put up the video, I'll be able to put it in the comments so persons can zoom into that. But otherwise, because you may have a few persons here locally that may want to reach out to you.
So my number, there's local account on it as well as PayPal, and also my number is also on the website.
All right, no problem. So you send me that and I'll put it down below. Ladies, I want to say to you, you are indeed warriors. And, you know, I really, you know what I'm really desiring right now? That all three of you could form, I don't know, form a group or something, an association, something that will help to support other women, because I think God is strategic this evening. I have 3 women at 3 different levels here, from the teenager to the young adult to the adult. And so we've just heard that endometriosis affects different ages. It's not it's not biased to say, well, I'm going to go for a 30 and not go for a 15, you know. And so ladies, I don't know if you guys are already a part of a group or something, but it would be so good if you guys could form that group, that support group that will help to support other women. I'm just putting it out there. I don't know, you know, and see if we can find other warriors to really help them through this. But let me say thanks again for coming, taking time out of your Sunday afternoon for us to have done this recording to help other women and girls locally and overseas to continue the fight. To not give up. I do have a question, you know, does endometriosis ever stop? You know, is this something that you will have to live with for the rest of your life? Does it ever stop?
No, it doesn't stop.
History has shown it progressing past menopause. History has shown it progressing even after hysterectomy. So hysterectomy doesn't solve it.
Yeah.
Otherwise, you could just jump to that right now and just call it a day.
Wow, wow. So there we have it. The fight continues. It's a never-ending fight. It's a lifetime of fight. So again, Kadine, Stewart, did I get that wrong again?
Kadine.
Okay, good. I got it right. Kadine, Stewart, Rene, Wint, and Nordia Barrett. Ladies, thank you. I want to really encourage you to keep the fight going. I want to encourage you to keep the faith. And it's a delight to hear each of you sharing that one of your main support and strong support has been your faith in God that has kept you. So I want to encourage you to keep the faith. And like I said, I want to encourage you. Nordia would have alluded to it, that find something, I mean, yes, in the midst of it to focus on. And it could be that whether it's your schooling, whether it's your career, or something, or just really that support system, find something to occupy yourself with, you know, so as to take the focus. Because I know just thinking about you locked down with your own pain can indeed be debilitating, for want of a better word. With this, I want to throw.
I agree with that.
Say that again, get ready.
I said I agree with that. You can't dwell in the pain, although it's what you're feeling at that particular time, but you can't dwell in the pain.
Yeah.
It'll drive you crazy. You have to get out.
You have to get up and go.
Yeah.
And
I'm
not saying be superwoman, but you can't dwell in the pain. Don't dwell in the pain.
Yes. If I should ask each of you to leave one word with a woman or a girl suffering, what would that one word be? Start with you, Kadine.
Trust God.
Trust God. So it's trust. Rene.
Fight on.
Fight. And Nordia.
Be kind.
Be kind. Trust, fight, and be kind. Be gracious, for want of a better word. Ladies, thank you so much for being here.
Thank you for having me.
Thank you.
You're welcome. Well, ladies and gentlemen, there you have it. A real fight going on here amongst our women. Endometriosis has been raging war on our women for decades. And guess what? It seems to be a lifetime war. But you can help a woman. Maybe there's someone that you sit beside in your office, a neighbor, a family member. Maybe you're a spouse or a mother, and you've had to watch them fight month after month. They have shared that there have been times when they've been knocked out, passed out. They have had to go to surgery or have done multiple surgeries. The medications are expensive. The impact is great, but the support, and we've heard that word so many times, the support. Let's see how best we can help a woman endure endometriosis. Let's wage war against this disease and see if we can help another woman to win. Thank you again, guys. You have been fabulous. It's always so good to see you here week after week. Next week, we'll have another unique woman. Don't forget to like, subscribe, and comment. See you next week. Bye-bye.
Calling our women from Spanish Town, Kingston, Montego Bay, St. Catherine, wherever you are, it is the Uniquely Me with Simone Stewart presenting Girl Get Up, Take Up Your Bed and Walk. It's a women's conference featuring Camille Cook, Donette Acosta, Simone Howard, Sheena Lynn Hanson, Rene, and Minister Clayton Roberts, hosted by Latoya Lang Smith. When will this be, guys, you ask? It's going to be Saturday, April 16, 2022, beginning at 9 a.m. Where? Open Bible Complex at Twickenham Park, Spanish Town. We are calling all our pastors' wives, women in leadership, women who have been through trauma and recovery. It doesn't matter, as long as you are called woman, you need to be there. Cost is only $1,500 and a pack of sanitary napkins. Guys, you ask why sanitary napkins? Well, we are launching the 2022 series of our period poverty campaign. You need to be a part of this. Our goal is to raise 2,500 packs of sanitary napkins for our girls and women in Jamaica who cannot afford these items. So guys, come on out. It's Saturday, April 16, 2022, starting at 9. It's entitled Girl Get Up, Take Up Your Bed and Walk. Refreshments will be on sale. We say uniquely me is uniquely you, and it's time, girl, you get up. See you there.
And uniquely me is uniquely you.
Hi guys, I
thought I would share with you, for those of you looking for a Christmas gift or a New Year gift or a birthday gift for that woman, that strong woman in your life, to offer the Uniquely Me Planner. Now, what can you find in the Uniquely Me Planner? You can find pages to write for each month. You have pages to write your goals, and we set it up so that those goals are smart, right? As you know, your goals need to be smart. So we have the specific, the measurable, the attainable, the relevant, and we put them in blocks so that you are able to fill them in accordingly. Also, you will find a daily to-do list, as well as for each day, if you need to put your calendar, what your calendar items will be, you have that as well. There's also a habit tracker, guys, or as well as a quote. There is a list for you to put what are your list of priorities in terms of things to be done. And of course, guys, we have pages and pages of that. We give you blank pages as well. So this is also, it is your diary, it's your planner, it's your time management tool is what I would call it. I want to encourage women who are creatives, women who are executives out there as well. You are trying to find a way to be productive. Here is your tool. And so, guys, it's on Amazon. Just put in Uniquely Me Planner, or you can put in Simone Stewart and grab a copy of my Uniquely Me Planner. Guys, remember, Uniquely Me is uniquely you. Get your copy today.
And uniquely me is uniquely you.
Who am I really? Choices, choices, choices. In pursuit of a career? OMG, I'm a wife. Help, I am a mother. Oh, I'm in church. When do I get to be a woman that God called me to be? Uniquely Me covers the acrobatic endeavors of every woman to balance the responsibilities of being a mother, a wife, a professional, a church leader, a friend, yet still maintain her identity. I too am a mother, a wife, a trained minister of religion, a banker, an entrepreneur trying to balance the many hats that signifies my role. My book will help motivate and empower every woman who is really unique in her own way. Grab your copy today on Amazon, because Uniquely Me is uniquely you.
Thank you for tuning in to Uniquely Me with Simone Stewart. Remember, Uniquely Me is uniquely you.